This is Bob Byrnes, Mayor of the City of Marshall. We're here this afternoon and this evening to give another update on where the city is at in response to the COVID-19 coronavirus situation. With me is, again, Dr. Steve Meister, Marshall City Council member and Chief Medical Officer at Avera in Marshall. Also with me is Jim Marshall, who is Police Chief and Director of Public Safety, and he's also our Emergency Manager for the City of Marshall. So as everyone knows, we are in a emergency situation. This is an emergency in preparation for what we anticipate being a health emergency. As we know, there's a number of businesses that are closed. The city offices are still open. Our airport is still open, and the library is still open. I also say that as of today, Tuesday, March 24th, it's about 2:30 p.m. This is the information that we have as of today. And as we all know, things are changing by the day. There are a number of things that we want to share, but I want to turn first to Dr. Steve Meister to give a brief update on the medical situation from Avera Marshall, and then we'll go to Jim.
Thank you, Bob. Again, it is Tuesday, March 24th at about 2:30 in the afternoon, and as of today, right now, there are no confirmed positive cases in Lyon County. Again, as Mayor Byrnes said, this can change on a moment's notice. The good news is we are actually getting our testing results a little faster than we had before. It was up to 5 to 7 days. We have started utilizing alternative testing sites. We collect the tests here in Marshall. We don't run the tests. The tests are sent off-site. We are currently using a couple of off-site places, and they are turning them around very quickly, and we are now getting them within 3 days. And I know that doesn't sound real quick, but compared to 5 to 7 plus days, it is real quick. And hopefully that'll get even faster in the very near future here. Again, I'm very impressed with the way that our citizens have responded to our pleas for asking you to stay at home and socially distance. It's working. We're noticing less people out on the streets. However, the pandemic is not over. We have yet to see the surge. We are anticipating a surge, which is the bad news. So again, 80% of people with this disease are going to be just fine. There'll be about 20% of people who get really sick. Again, if you're concerned about having the disease, call 877 at Avera. You'll get screened whether or not you need to come in for collection of the testing. Then, if you are appropriately clinically and not in distress, you'll be sent back home to kind of shelter in place or stay at home in your own self-quarantine amongst your own house and family. If you are really sick, having difficulty breathing, shortness of breath, high fever, come into the ER and then we'll check in, make sure that you're okay. We are doing well. We're prepping up and preparing ourselves for a potential rush that we hope never comes. There's a mantra that we're using right now as our guide. Everything we do before a pandemic will seem alarmist. Everything we do after a pandemic will seem inadequate. So we're preparing as though we're alarmists. That prepares us well. We ask again that you don't just come in to be evaluated without calling that number, 877 at Avera first, because we don't want to put our healthcare workers at risk. If our healthcare workers get really sick, we're in rural Minnesota. We don't have a huge depth, and this is not unlike the big cities that are also having these problems right now. Healthcare workers do not grow on trees, so if we get sick, and we're humans too, there'll be nobody to take care of you. So we ask that comply with our requests. If we ask you to put a mask on, please do. If we ask you to stay at home, please do. And remember that if you are having a medical emergency, really short of breath, high fever, chest heaviness, anything like that, please come in through the emergency room. Bob?
Thank you, Dr. Meister. Jim Marshall, as I mentioned earlier, is our emergency manager director for the City of Marshall, and certainly the City of Marshall, since last week, has been under an emergency declaration. That means that we have implemented our emergency plan. That means that our emergency operations, which covers all types of emergencies, be it from weather-related emergencies to, in this case, a health emergency, that's what the plan is for. We have activated our Emergency Operations Center. That's where our City Council will be meeting this evening, and we are complying then with the guidelines of fewer than 10 people that will be congregated. So we'll be limiting access to that meeting site, but we will be doing our best to connect people by distance. So I asked Jim to give a quick update of where we're at with our emergency operations plan and any other input you have as Public Safety Director. Jim?
Well, thank you, Mayor. You know, back in March 12th, we pulled together our leadership team for the city, which really functions as our incident command structure for the city of Marshall. At that time, we started to plan and prepare for this upcoming pandemic. We've continued to communicate and work through this together. And we're really focused on three different areas. Number one is, I'm going to say Avera. We know that our healthcare providers are going to be on the front end of this. They're in the front lines, and we want to make sure that we're doing everything that we can to support them with this. They've been planning and preparing for this for quite a while. It's been on their radar long before it was any of ours. They've got a strong command structure in place. They've been moving forward and working well. And appreciate Dr. Meister and their willingness to be such a great resource to the rest of us within the community. I know Dr. Michaels as well has made himself available for questions. The second part of this is city functions. I mean, we still have a responsibility to ensure that our city government is functioning. We've put measures in place so that the city council can conduct the business of the city. And along with that, though, we have other essential functions, critical functions, public safety. You know, the law enforcement side aspect of this to ensure people are protected, that their constitutional rights are being protected. And I've worked close with the Sheriff Wallen to ensure that we're able to provide that coverage, both short-term and long-term, depending on how this impacts our departments, that they can provide coverage for us, and we in turn can provide coverage for the county if need be. As well as other city functions, Mayor, that we need to talk about. Both Mayor and I know that as we move into April, it's also known as our Severe Weather Awareness Month. And we need to ensure that our wastewater plant is working the way it needs to be, that our Public Works Department is hitting on all cylinders during this time. And then the third area that I'd say our leadership team is really focused on is the economic impact that this possibly could have on our community. And I know Mayor, you and our City Administrator, Sharon Hansen, have been working tirelessly with our state elected officials to come up with ideas, creative ideas in which we can ensure our business community makes its way through the strong.
Thank you, Jim. So the public, I want the public to know that while we don't know what's going to happen in the future, we do know that we do have a well thought out and implemented emergency plan that's working as we intended it to work. We don't know what tomorrow will bring, but we do know where we're at today. Jim mentioned the economic impact. We have a number of businesses by governor's orders that have been closed. That includes bars, restaurants, salons, and other types of businesses, museums that are closed. Many of our bars and restaurants especially, are offering some curbside service in order to serve their customers and also kind of keep some level of viability with their business. So, and our grocery stores are still open. So where possible, I would encourage people that if they have the means, that they continue to support our local businesses. We will, as Steve has said in the past, we'll get through this, but it'll be a challenging time. If people have questions, certainly contact health-related questions, contact Avera, city-related questions related to any city operations, contact the city number. And finally, let me say that this is a time that we also, unrelated to our state of emergency, we're also asked, every citizen, every resident of the United States is asked to participate in the census. Residents of Marshall are no different. So in the past week, every address received an invitation to go online or call to complete their census form. I would encourage, even though we're in this time, the census is important. Doesn't take very long. It took me 6 minutes to complete the census for my household, and then it's done. Those are the numbers that will impact many, many things over the next decade as we recover from this emergency. With that, this is Mayor Bob Byrnes.